But joining us now, and we do need to speak to him immediately, is Professor Carol Sikora, an oncologist of 50 years standing. Professor, I'm very glad but also sad to have you on the programme discussing this. Kate certainly has depicted what's going on as a situation unexpected, a great shock, something that's going to have to be dealt with, but also in a positive light, yes, preventative chemotherapy. And she's told her children she's going to be fine. Obviously, we hope that's absolutely the case.
I think there's a good chance she will be fine. Modern oncology, modern cancer treatment involves assessing the risk of recurrence of the disease. And if the risk is high, then we would recommend chemotherapy, even though there's no disease detected. And how we get to that conclusion is looking at the pathology. It takes time, maybe 2 weeks, sometimes genetics of the tumor, looking at DNA sequences in the cancer. And then we put it all together and assess the risk of the cancer coming back. If it's high, we recommend what we call adjuvant chemotherapy. She called it preventive chemotherapy, same thing. Adjuvant is just Latin for throwing. So we throw in the treatment to try and reduce the risk of the disease coming back. She's great. She'd be a great patient, I can tell. You can tell within 10 seconds of meeting someone if they're going to be a good patient or a difficult patient or an awkward patient. But she would be a great patient to have.
Tell me, Professor, what are the characteristics of a good patient? A nice nature and a kind heart, or is it something else?
No, it's just an attitude, a positive attitude to life. And, some people crumble when they get cancer and they get very depressed, they get morose, they go quiet, they don't want to talk to people, they don't want to go out, they hide themselves away. And that isn't great. It's much better to have someone that's positive. We're going to get over this. And also someone that has family support. People with such a strong family support, not just the immediate family, but the wider royal family, they're just a typical British family, for goodness sake. It's lovely to see. We all have problems, we won't mention what they are. Every family. I have problems. I have 6 grandchildren. We have the odd problem here and there. But on the whole, it's great.
Talk to me a little bit about chemotherapy in 2024, right? Because obviously, cancer drugs and treatments have evolved really prodigiously and incredibly impressively in many areas of oncology. And I'm wondering about what chemotherapy is like in 2024, what the experience might be like, and how it might be for someone navigating it.
So chemotherapy involves going to hospital. You can have it at home, but most people go to a hospital clinic run totally by nurses. There's no doctor in sight, and that's great because nurses are much better at putting the needles into veins. Most chemotherapy is given intravenously. For colon cancer, there are different types of combination chemotherapy. It's usually used, the usual one is called FOLFOX. It involves 3 drugs. One of the drugs is given over 5 days, the other one as a direct injection in hospital. It's tedious having chemotherapy because it's done over a period of months, usually 6 to 8 cycles over 4-month period, means going back, having blood tests to check that the chemotherapy hasn't affected the bone marrow that produces the white and the white cells and the platelets. And on the whole, we're so much better now at managing the side effects. The sickness has gone. There's no doubt people shouldn't be sick on treatment because we have very good drugs to prevent the sickness. People feel tired, and the tiredness is not just the drugs themselves, it's the whole process of having to keep going back, having tests, having x-rays, scans, and this sort of thing. But the big change since I started, my first year was a registrar at St. Bartholomew's Hospital in oncology, working with a great consultant. And it was hassle. You had to draw up the drugs late at night and give them. The doctor drew them up. Now it's the pharmacy, the nurses, the whole logistics of having treatment. So much nicer for the patient.
And so you feel that there's cause for significant optimism tonight, despite the shock of hearing this news and despite looking at Kate looking a little pale and a little frail and rather thin. You feel that her kind of top spin of optimism is one that's justified and that we can put faith in.
I mean, obviously, we haven't seen any medical details. They're confidential between the treatment team and the family. But all the indications are good room for optimism. And I think, she's being optimistic in her interview. And I think we should all be optimistic. She can get through this. And let's hope she does. And after 6 months, has a nice holiday somewhere in the sun, opens a bottle of champagne, and it's back to normal duties again.
Thank you very much. Hear, hear. Dr. Carol Sikora there. Thank you.